What's up, you guys? It's Marty. Talk about the power of Google. The last time I posted anything on this channel were my first two videos, and that was 10 months ago. And to be honest, I put them up and kind of forgot about them. Just got busy with work. I took on another job. It's a travel PA position that I've been loving so far, and I guess it's something that I'll probably share with you guys here as I probably make more videos because it was interesting. I had to do some taxes since it's the early part of the year. And like I talked about in my last video, I wrote a book, what was that, 3 years ago now, called Becoming a PAC, Your 10-Step Guide to America's #1 Profession. And basically had to just check and see if I had sold any books, which I didn't think I had because basically I stopped trying to sell just as I got busy with my new travel job last year. What I learned is it's easy to write a book, it's hard to sell it on Amazon. So, but anyway, I was at work and found that I had sold like 4 or 5 books in December, which I know isn't a lot, but like a lot for me because, I had no goals going into writing that book. And the fact that I sold 5 books just organically without doing anything, I thought was super cool, which got me thinking, like, how did I even sell those? And then realized that I had put some links in the description for my last videos and wondered if that was maybe how I had got some traction, which led me back to those videos. And oh my gosh, did not realize that I would get this many views. Part one of why I left PA school had gotten over 1,100 views, which again, I'm not a YouTuber. I'm not trying to, have 1,000, 100,000, million subscribers and, work full time making YouTube videos. But, for someone that just literally had no intention, just posted a story that I'd wanted to tell for a long time on YouTube, and for it to get, a significant amount of views, I thought was really cool. And then just, people commenting about similar experiences and just being very grateful for me sharing my experience and how it helped them, and asking me to go in a little bit more depth about some of the things I did in my off year and my PA Bible, my spreadsheets. It just felt really cool, and like anything, especially in healthcare, we get, really excited when we feel like we've done something to improve someone else's well-being or livelihood. And so, I don't know, just even 1,000 views and a few comments really just got me excited. And so here we are making another video, hopefully one of many to come, about all things related to PA school training, working in healthcare, the current state of healthcare in this country, ideas I have, just kind of thinking about, things that get me excited as a healthcare provider, thinking about things that we could aspire to as a country, how we could completely rechange healthcare to, refocus on making us healthier, making our patients healthier, helping prevent burnout for healthcare providers. So yeah, it's, a conversation that I want to be a part of. It's cathartic for someone working in healthcare that does have to face all the same challenges that make healthcare providers burn out, to have an outlet, to have somewhere that they can go and talk about their experiences and their ideas for how things could be improved. It's worth making these videos, even if I'm only helping a few people. It feels good to me to know that it's making a difference for somebody. So I want to dive into this topic for this video, which is kind of a good strategy for how to study in PA school. I talked about in my last video about how one of the biggest challenges of PA training, medical training in general, is the amount of knowledge that you have to learn and retain and digest in a short period of time. There's a statistic that I heard one time that always kind of sits with me, and I had to look it up, but it's estimated that the doubling time of medical knowledge in 1950 was 50 years, and then over time that has gotten significantly shorter, just based on the amount of medical research that's happening every single year. So the doubling time of medical knowledge in 1950 was 50 years. By 1980, it was 7 years. In 2010, it was 3.5 years. And then in 2020, which was the last time, or I guess when these projections happened, the doubling of medical knowledge was expected to occur every 0.2 years, which is just 73 days. That is incredible when you think about it like that. Even though the amount of medical knowledge has significantly and astronomically increased, we still are a lot of the same amount of time in our medical training to essentially bring us up to speed and become competent so that we could start practicing medicine and seeing patients after we graduate. So getting back to the point though of why this is all important is one of the most stressful things, I know that was stressful for me about becoming a PA and in my PA training, was how do you learn and retain this immense amount of medical information. Everybody learns in different ways. And again, there's not a one size fits all to how you approach learning in PA school and retaining information. But what I found for myself is what I did in undergrad, which was just take a lot of paper notes on a lecture or whatever, did not work well. It was not suited well for me in graduate school in my PA training. What I found is while, taking all of this information down on paper may have been helpful for me to, study for tests, having, 1 or 2 pages of bullet points from a lecture may be a great way to, retain important bullet points so that I could reiterate it for a test. But the problem is with medical school and PA school, which is a little bit different than undergrad, like you are expected to be able to have this knowledge base and be able to recall things from what you've learned in your clinical year of training when you're actually out seeing patients. And unlike an undergrad where taking notes and studying bullet points for tests was helpful, oftentimes like I would forget most of that information within a short period of time. And thinking about PA training, having a huge stack of papers from all of my studying for my didactic year, like that's not really helpful when I'm in clinic with a patient trying to figure out that one random fact from a lecture that maybe I had 8 months ago and having to try to search through essentially a pile of papers to figure out where I learned that specific piece of information that I need to help me in the care of this specific patient. And I remember going to these picnics and these bonfires with some of the medical students, and they would be in their 4th year and just finishing, and they would have like these bonfires where they would bring all of their binders and binders of notes and things that they had used to help them study, or things that they had created, their study guides throughout the 4 years of medical school. And they would essentially just throw them into the bonfire, which to me was like mind boggling. This is the fruits of your labor. And just to like throw it in a bonfire, it was just like symbolic on so many ways. One, it just shows that a lot of the times how we study for medical school and PA school, and it's not very efficient. Our time is not being spent well creating all of these great study guides that we are essentially just going to throw in the trash and start pretty much anew as we transition into our clinical year of seeing real patients. So what I did, I created what I call my PA Bible, and it is an Excel spreadsheet. And for me, it's a way to catalog all of the information that I learned in PA school. And surprisingly, it's something that I still use to this day. The thing that I really have found that I liked about it was in PA school, I used it as a way to just catalog and document everything that I had learned and have it in a place where I would be able to easily access all of it. But now I'm finding that, as things change, as I continue to do continuing medical education, and there are new guidelines and protocols coming out for, various medical conditions and how we treat things, I'm able to go back into this document and edit it in real time. And as I grew in my career, this Excel sheet is also evolving and growing as I continue to learn in my career. So that's been very, very helpful. And, from a mental health burnout standpoint as a PA student, I think the biggest thing is when you have a document where you're able to catalog all of the information that you've learned, you can kind of release a little bit mentally, knowing that it's okay for things to leave your brain because you know exactly where to find it because you've created it and you know exactly where you've stored it so that you can focus on moving on to the next thing that you have to learn. It was something that was incredibly relieving. It made me feel really secure. It made me know that, hey, yeah, I've learned this. I've processed it. I've cataloged it. It's here. If and when I get to the point in my clinical training, after didactic training, where I have a patient and I remember that I need to know these random points or the pathophysiology or the treatment for a medical condition, rather than going into, a big file cabinet of, study guides that I had made, which would be nearly impossible to decipher and go through in a relatively short period of time. I can just look in my Microsoft Excel sheet. And the nice thing about it too is that you can access it anywhere, like any desktop computer, on your phone. So it's also readily accessible, which is really nice. So what I want to do next, I'm just gonna show you. It's a pretty, again, basic Excel sheet. As you make your own, everyone can customize it in a way that works for them. But I thought I would just show you mine so you can get a little bit of idea of how I structured mine. And again, not a YouTuber. I'm just for the first time figuring out how to record my screen in real time. So this has been a fun learning experience. So this is my PA Bible. And so as you can see, I have a bunch of tabs down here, and we'll go through those shortly. But just to give you an idea, so what this first tab is showing is kind of how I structured taking notes for all of the big areas of medicine. So this is my tab regarding everything I learned in my neurology unit. And as you can see how I set up the columns on top, I have the syndrome, the medical condition. Next to that would be signs, symptoms, and diagnostic workup, including labs, imaging. That's the second column. The third column is the pathophysiology and epidemiology regarding the medical condition. The next column is treatment and management. And then lastly, this is a column that I use a little bit, but oftentimes it's not something that I filled out too much, was the prognosis for patients. But this is kind of how I structured all of the big topic areas that we studied in PA school. So again, this would be like neurology. When we got to the psychiatric unit, I had one entirely for psych, ophthalmology, hematology and oncology, endocrine, ENT, dermatology, orthopedics, women's health, cardiology, pulmonology. So that is how I formatted everything. Just to kind of give you an example again, let's go into Bell's palsy. So again, I have the name listed, and then again, I would write down the signs and symptoms, how we diagnose it. Again, go into the pathophysiology. And I apologize, some of the stuff has not been updated since PA school, so I'm sorry if anything is out of date. And then again, treatment management, where I put the medications or any therapies, and then prognosis. The nice thing about Excel is the fact that you have the ability to, link stuff into the document. So for example, for Bell's policy under, pathophysiology, I have some random document linked regarding facial nerve 7. And let's see what happens if I bring it up. So yeah, it's just kind of review of the anatomy regarding the facial nerve. So it's also a nice way to link things in from your studying and training that you may also find helpful. If you have a patient with Bell's palsy, be like, oh yeah, what is the anatomy of cranial nerve 7? So it's also a very efficient way of looking up relevant information regarding the whatever medical condition that you are looking up. So that was kind of the first series of tabs that I made in my PA Bible. But then what I also did was create tabs regarding, the physical exam. So most students have a H&P course where they learn how to do a full physical exam. And there's a lot of, tests that we learn that have specific names and pertinent findings. And that can be also another large amount of information that is hard to retain. And so having a place for that in my P Bible, I found was really helpful. So, for example, here under my physical exam for eyes and vision, I have how we test visual acuity via the Snelling chart, kind of some of the how we use abbreviations in our medical documentation under charting and findings, So it's also another great way to catalog pertinent information that we learn in PA school and have a place to easily retrieve it. Because again, you will be in your clinical year and your preceptor may ask you to go and, hey, can you do a good, eye and vision exam on the patient? And trying to remember like all the things that are a part of that specific physical exam can be a little daunting. And oftentimes that will be a reason why we are going back and trying to find a textbook about how to do a thorough exam of the eye and a patient's vision. So having that all in a nice organized area, it's all bullet points and stuff that you created, it was very helpful for me in my clinical year. Another tab that I created were labs. I thought it would be very helpful to be able to have a place where when I review labs, I can go and figure out, you know, what is normal, what is abnormal, and what are some of the causes of abnormal findings. And, as I went through my didactic year, as we learned like a new lab test, I would just put it here and make some relevant notes regarding those lab values, which I will say is something that I still relatively use, especially in the inpatient side where we do a lot more lab testing. And, just for example, here is my basic metabolic panel. So, one of the components of that is, your sodium level, and every lab is different in terms of their normal lab values, but I would have like my normal reference range right here, and then getting into, some of the pertinent points regarding hyponatremia symptoms, and then something that I find is super helpful, underlying causes. So a list of medical conditions that could lead to hyponatremia, which really important in your early training and in clinical year when you're trying to build your differential diagnoses. So that was really helpful. And then having, well, how do we treat hyponatremia? So having that all in a spreadsheet all in the same area just saved so much time for me as a student, especially in my clinical year, as I was trying to come up with plans to give to my preceptors regarding whatever things that we were treating with our patients, rather than having to go run and find a textbook or a random PowerPoint where that information was stored. As you can see here, I've made so many tabs during my training. In my ED fellowship, we got trained on ventilators and I spent some time in the ICU. So I have tabs all about things that I learned during my training so that I could easily recall it and find it. So as you can see, this has been a growing document. It's been a great way to have a one-stop place to put all of the information that I've learned in PA school and in my training. So I like that I have it all stored in one easily accessible place. The last thing that I think is really important, this is something that I started to do kind of in my clinical year and beyond, were tabs regarding like a chief complaint. So again, learning how to build good differential diagnoses for different chief complaints is, a very important part of being a healthcare practitioner, and it's something that's very challenging for an early student. So having a go-to place to at least have, a good idea of things that could present, like for like example, abdominal pain was also really helpful as I started out in my career and in my clinical. So, abdominal pain, the things that can cause abdominal pain is pretty long, and how I kind of structured it, like things that were kind of most emergent, I would always put in top in red. And so, just kind of going down the list of things that can present as possible abdominal pain. And I kind of have it all subdivided into the different areas of the abdomen. So, right and left flank may consider, kidney infection or a kidney stone. Right upper quadrant, gallbladder issues, not forgetting to think about, the bases of the lungs, a right lower lobe pneumonia or a right lower lobe, pulmonary embolism. So again, a great way to have a place where, as I'm learning about medical conditions, being able to, like, hey, I should add that to my, my tab on abdominal pain. As I learned about appendicitis, be like, hey, yeah, I should consider that always in my differential if a patient comes in with right lower quadrant abdominal pain, right? And it's funny, like, now it's like after a couple years of practice, like, yeah, like that which should be like obvious. But when you're a brand new student, like, and you're learning about a million different conditions, it's hard to organize all of this in your head so that when a patient comes in with abdominal pain, you can make a very good educated differential diagnosis for that patient. So this is something that I used frequently working in the ER and urgent care when a patient would come in with various chief complaints, making sure that I was considering all of the emergent things, the things that were important to rule out, but then also having, again, a complete list of things for me to consider for that patient. And as you can see, I, have special subsettings for pregnancy. So very, very, very helpful. And then lastly, this is actually a separate spreadsheet in and of itself, but one thing we often do in PA school are make, farm charts where we uh, have a list of all pertinent medications in a specific, area of medicine, like cardiology meds, pulmonology meds, et cetera, et cetera. So I'm essentially I made my farm charts, but I just did it in Excel. Again, having something on paper, it's good. It's a great way to study, but what is the utility of that after the test is over, and how do you continue to add to it and edit it? So I found making a Google document, a Google sheet for my farm charts was very, very helpful. And as you can see, 'cause I used to work in the emergency medicine, I would have a quick one for all the common medications we use in the emergency department, both adult and peds dosaging, because having to look stuff up on UpToDate or in books, like, it takes time. And so having this Google sheet up, at all times just made things so much easier and quicker to find. But, I have ones, again, all the meds you learn in neuro. Like, for example, here is all the seizure medications stood out. And again, the way I kind of organized my tabs was, one, the medication name, indications for use, the mechanism of action, contraindications, major side effects, and then like the pharmacokinetics, like, how is it metabolized, kidney, liver. So again, a great place to have all this information stored, a great way to study pharmacology in school. And then also, again, this is a great document then to take into your practice and add to and edit as you move on in your career. So yeah, I think I'll keep it at that. That's like kind of all the big things that I wanted to talk about regarding, how I kind of set up these Google documents, these Google Sheets. So I hope that it's something to consider for any current or future PA student that's trying to figure out the best way to, again, organize all of the information that you are about to learn or are learning. Hopefully, my biggest goal is just to help kind of bring down the stress level with regards to the stress related to just having to learn an insurmountable amount of knowledge in a very short period of time. So I hope you enjoyed this video. Again, I hope it's helpful. It's, for me, like, making these videos is so important, even if I'm only helping a couple people, like, it feels good for me. So I really appreciate taking the time to watch the video, and hope that you guys have a great time studying. Remember, enjoy the process of being in PA school. Like, it's an opportunity to, work in a career where you do make a huge impact on people's lives. I think the study of medicine is so great because it's always changing. It's always, we're constantly innovating. There's always something new to learn. And, the great thing about it is we can make some substantial impacts on people's lives as healthcare practitioners. So I know it might be really stressful and everything right now, but try to find, the joy that you had and made you want to go into the medical field. Have fun learning, enjoy the process, and hopefully, again, this approach to all of the medical knowledge and everything will just make things a lot more easier and enjoyable for you. So with that, if you do have other questions, comments regarding these spreadsheets, please feel free to put in the comments. I'm going to start, monitoring the comment section a little bit more. Again, I really like hearing the feedback that you guys have. Just looking forward to helping you guys out in any way that I can. And then also, if you have any topics or anything you want me to make videos on, again, please feel free, put them in the comments. Again, I just started a travel PA job, which has been pretty fun and exciting. I'd love to talk to you guys about that, or anyone that's interested in travel medicine. I'm going on about being a PA for 5 years. So, I've done a lot, seen a lot. So please feel free, any questions at all you have regarding the PA profession or medicine or anything, let's start a conversation. All right. With that, hope you guys have a great rest of your day, and I'll talk to you guys soon.